Let's talk about the bony landmarks of the femur. Femur is a long bone, and this is going to be the bone that's found in your thigh. If we look at the proximal end of the femur, we first notice this round ball-shaped area, and this is the head of the femur. If you look a little more closely at the head of the femur, you see this small indented area. This is called fovea capitis. And this is a little pit or indention for the insertion of a ligament that also contains a blood vessel. We talked about this in class. That blood vessel supplies the head of the femur with blood. If you come down just distal to the head of the femur, you see the smaller narrow area. This is the femoral neck. Okay, this is the area that's most likely to break in a hip fracture. And then if you come just distal to that, you'll see these two landmarks here. So here is greater trochanter. It's going to be more lateral and superior. And if we come a little more medial and inferior, we see the lesser trochanter here. Okay, so all of these structures will help us determine whether this is a left or right femur. The head of the femur is always going to angle medially so that it can articulate with the acetabulum of the coxal bone. Greater trochanter is always going to be lateral. Okay, and we'll talk about a few more clues. If you look on the anterior aspect of the femur, you're going to see this bony, small bony ridge. This is the intertrochanteric line, and that's going to be anterior. And if you look at the posterior aspect of the femur, you see a larger bony ridge. It's more pronounced posteriorly, and that is the intertrochanteric crest. Okay. Also, if you look down the shaft of the femur, you'll see the linea aspera, and that's this raised bony line on the posterior diaphysis of the femur. So that's linea aspera. So that'll also give you a clue that this is the back of the femur, this is posterior, and the nice smooth diaphysis is going to be anterior. So based on what we're seeing here, this is going to be a left femur. So you should try to picture that in your head. Also, if we look at the distal end of the femur, that'll give us a couple more clues. On the anterior distal surface, we see this nice smooth indented area. This is the patellar surface. So this is the area, the small indentation is where the patella is going to travel superiorly and inferiorly as you extend and flex your knee. We also have on the very distal end of the femur the medial and lateral condyles. So these are articulating surfaces where the distal end of the femur is going to articulate with the tibia. So just proximal to that are these kind of raised bony areas, and these are epicondyles. So they're above the condyles. So medial epicondyle and lateral epicondyle. Okay. And if we look on the posterior aspect of the femur, we see this large indented area, and this is called the intercondylar fossa. So it's between the condyles, so intercondylar fossa.